Ever found yourself pondering the question, what causes keloids and hypertrophic scars? Well, it's a topic that's as fascinating as it is complex. Keloids, to start, are firm, smooth, hard growths that arise due to excessive scar formation. These peculiar formations can occur after a skin injury, with certain areas like the upper chest, shoulders, ears, and neck being particularly prone to them. Interestingly enough, keloids can also occur spontaneously without any significant preceding skin injury. In contrast, hypertrophic scars are confined to the area of damaged skin. They occur when there's a lot of tension on a healing wound, resulting in a scar that's thicker than usual. Compared to keloids, hypertrophic scars are more likely to regress and resolve. But who exactly gets these types of scars? Hypertrophic scarring can occur in anyone, regardless of age or race. However, keloids are less common and are more frequent in individuals with Fitzpatrick skin types 3 to 6. They're self-reported in 16% of Black individuals and are more likely to be developed by Chinese individuals compared to those of Indian or Malaysian origin. White-skinned individuals and albinos seem to be the least affected. There's even a noted genetic association with some HLA haplotypes and blood group A. The exact cause of keloids and hypertrophic scar formation remains a mystery. But it's believed that keloids may develop after minor injuries such as trauma, burns, insect bites, surgery, and even acne. The process involves a dysregulation of the normal healing process, resulting in an excessive production of collagen, elastin, proteoglycans, and extracellular matrix proteins. Keloids and hypertrophic scars have their unique clinical features. Keloids are usually purplish red, firm, smooth, and raised, and can be uncomfortable and itchy. They can occur years after an injury and grow beyond the initiating wound area. On the other hand, hypertrophic scars are generally pink to red, slightly raised or flat, and are also prone to discomfort and itchiness. These scars usually occur within weeks of the injury and are limited to the confines of the initiating wound. So why should we care about these scars? Well, apart from the cosmetic disfigurement, they can have adverse social and psychological effects. Thick, tight keloids may even limit movement and limb growth in children and cause suppuration.
Keloids and hypertrophic scars are primarily diagnosed based on clinical history and features. On occasion, a skin biopsy might be needed to clear any diagnostic uncertainty. The process might sound complex, but it's all about observing and understanding the skin's response to injury. Now you might ask, what's the difference between keloids and hypertrophic scars? The answer lies in their characteristics. While both may arise from injury and have a raised appearance, keloids grow outside the wound's margins and do not regress. On the other hand, hypertrophic scars may resolve spontaneously. When examined under a microscope, hypertrophic scars show an increased number of fibroblasts and a higher density of collagen fibers in the dermis. Keloids, however, present with thick, irregularly located collagen bundles known as keloidal collagen, which may be absent in up to half of the keloids. It's crucial to distinguish between keloids and hypertrophic scars, as they can mimic other skin conditions such as skin tumors, cutaneous squamous cell carcinoma, cutaneous pseudolymphoma, lobomycosis, and morphea, to name a few. The treatment for these skin conditions varies. Hypertrophic scars may resolve on their own and are generally more responsive to treatment than keloids. The goal of treatment is to reduce cosmetic disfigurement, functional problems, pain, and itch. Treatments may range from emollient creams, silicone scar reduction patches, and surgical excision, to intralesional corticosteroid injections, cryotherapy, and even botulinum toxin injections. Prevention strategies include minimal tension surgery, aversion of wound edges during suturing, limiting the number of sutures used, and avoiding unnecessary surgery or cosmetic procedures in keloid-prone individuals and areas. Although harmless and non-cancerous, patients with keloids have a slightly higher risk of skin cancer than non-keloid individuals. Despite this, the majority of hypertrophic and keloid scars do not transform into skin cancer.